Guys, welcome back to Medical Coding with Blue. Today's episode is all about what is the difference between the CCA and the CCS credential. So if you're brand new to my channel, welcome. I am Blue, I'm a medical coder. A lot of people will ask me, they'll be veterans in the medical field already, and they'll ask me, Blue, which one should I start off with? Should I start off with the CCA or should I start off with the CCS? The CCS says that you have a mastery level understanding of medical coding. So I'm really confused about which one I should start with. Which one should I go for? Everybody seems to be asking for the CCS. What is your suggestion? Okay, here's the deal. Now the CCA, I'm going to start off with that one, is your brand new entry-level medical coding credential for the American Health Information Management Association, right? This says that you have tested and you have a general understanding of inpatient medical coding rules and outpatient medical coding rules. This says that you can use both the ICD-10 PCS manual, the inpatient procedures manual, as well as the CPT manual, the outpatient procedures manual, right? It has all of your evaluation and management codes in it as well. So this says that you have that knowledge. You have the fundamental basic knowledge of medical coding that you can start off anywhere. You can start off in the inpatient side of the house. You can start off in the outpatient side of the house. You can go anywhere with this one credential, right? Which is nice because not all credentials cover both inpatient and outpatient. And for some associations, you have to have multiple credentials in order for this to be known. If you stroll up in there with the CCA, they're going to know that you are brand new to the medical coding world and that you have little to no experience, but that's okay because this says that you have passed a very difficult exam. I believe the last that I saw, the first time pass rates for CCA was 82%. Okay, so this exam is going to take more than a wink and a smile to pass. This is a 2-hour exam, but don't let its size fool you. This is going to cover a lot in those 2 hours. So having a CCA credential is very worthy, right? You are going to be able to work anywhere. I got that was my first credential that I got in 2008, and I had it for many years. I stubbornly held on to it because of the simple fact that there is a lot of trash talk in the industry about the CCA, and I think that there should be more positive talk about the CCA because that says a lot about somebody who's brand new to the field, that you understand both inpatient rules and outpatient rules. So I believe that that deserves a lot of respect. So I started off with this. I had it up until March of this year when I sat and passed for my CCSP, my Certified Coding Specialist Physician-Based credential. And, you know, that is what I now carry. When you have a credential with a HEMA and you start off with the CCA is dissolved once you either get the CCSP or the CCS, which leads me into my next part of this presentation. The CCS, the Certified Coding Specialist. This is the gold standard of medical coding credentials because this credential also says that you can code both inpatient and outpatient. It is asked for quite a bit on the job listings. Whenever you're looking for job listings, you will see that the CCS is asked for like 99.99999% of the time over any other medical coding credential. So this says that you have mastered the inpatient and outpatient setting. This is a 4-hour exam, okay? And also it's covering everything, right? It's like the CCA exam, but more beefed up. It's on steroids because it is longer and it is going to be asking you more in-depth questions, right? And so that is the big difference between the two. One is longer and one is meant to show that you have mastered. The other one says, the CCA says that you are a beginner, that you understand it, but that you're still learning as well. So with the CCS, it does not guarantee that people who have the CCS know everything, okay? So think about that as well, because I think that stops some people sometimes from taking that because they read that and say, well, I haven't mastered it at all. It depends on the program that you're learning from, or if you're studying on your own, how confident you are when you walk in there, and how much did you learn, how much are you able to recall, and that kind of thing. If it doesn't make sense, if what is happening in medical coding that as you're learning it doesn't make sense, it will as you get into the outside. But as long as you know the rules and you know those foundational steps to coding, then you're going to be able to make it. You're not supposed to understand everything right out of the gate. That's impossible. Even for really smart people who have studied a long time, or who know a lot, or who are, you know, coming from perhaps being doctors or even nurses, you know, or somebody else in the medical field, like an x-ray tech or a respiratory therapist. You know, there's lots of different people who are trying to get into medical coding because of their knowledge of medical on the medical side. It is really good to have that foundational knowledge already out of the gate, because knowing your anatomy and physiology, pathophysiology, and medical terminology is going to really help you to know and be able to comprehend this documentation. When it comes to understanding medical documentation, does it help to know and have that experience previously? Yes. Do you need it? Absolutely not. I came in from having zero background in medical. I knew nothing about being a medical coder. I didn't even know what a medical coder was. And I knew nothing about medical terminology, but I was a reader and I'm a studier and that kind of thing. So that helped me to be able to get through that time. So if that is where you are and you have no background yet, just because you have no background does not mean you can't be a successful medical coder. And I have gotten to the point where in my career, I have trained other medical coders, I've trained nurses, I've trained doctors. So I've trained degree holders. So I've trained pretty much everybody, anybody and everybody at all educational levels. And now if I can do that and I have my certification only, you know, there's no limit to what anybody can do if they put their minds to it, okay? So if you are somebody that's coming from the medical side and you want to see, well, which one should I go for? You can really start off with either one, the CCA or the CCS. If you want to just sort of get into it and try to decide, will I like medical coding? Because as much as I love medical coding, I will say that medical coding is not for everyone. Not everybody that gets into this or studies it or goes to school for it is going to truly understand or appreciate it. Because there are times when, there's many factors why this happens. It depends on the person's attitude, number one. Number two, it really depends on who is educating them. Because I believe educators can really make or break people and their dreams and things like that. So if you are in a good school, there's a good chance that you're going to see the positives about it. And then if you are in a school where they're just there to accept your money and this is what the program that you paid for, and we don't really care about what happens to you, that can affect your attitude if you allow it to. I've seen many people who go through this, who say, well, Blue, they promised me all this and all that, and they said that I was going to be able to work from home right away. They said I was going to make this huge salary. Let's be realistic, folks. Let's be realistic about the things that we expect when it comes to a career field like this. Is the money good? Yes. You can look at your area, wherever you live, because it is different. The starting salary for medical coders is different anywhere you go. Please don't ask me what the starting salary is, because what I believe is a good starting salary, somebody else may not believe is a good starting salary. And again, every place is going to be different, because you have people in Michigan who make different money from people who live in Florida. Same thing in Texas. You have a certain starting salary here in Texas. It's going to be different in New York. So keep that in mind when you are doing your research. And do your research. Don't just sit and ask questions that can easily be answered by going to the websites. When it comes to, well, should I go for the CCA or the CCS, or should I go for the CPC? Again, with the CCA or the CCS, you're going to be able to apply for jobs that are in the inpatient setting or in the outpatient setting. So that's really a good deal. You're doubling your chances with just having one credential. Now, if you were debating on whether to go for the CPC is a certified professional coder, and that is a credential offered with AAPC. That is completely separate. It has nothing to do with AHIMA's credentials. Now, when you first get that CPC, it will have a -A for apprentice, right? And that just means that's a 2-year commitment that says that you are brand new, that you are still learning. People are able to get jobs with the CPCA all the time. I know, because a lot of my audience, and I'm an AHIMA member, okay? But a lot of my audience is with AAPC. So that is totally fine. You know, I tell people all the time, I don't look at the credentials they hold. I look at the caliber of the coder, because it doesn't matter if you have a CCS. I've seen CCSs struggle. I've seen CPCs struggle. I've seen every single type of person with all different credentials, some with many credentials. I've seen them struggle with medical coding. So it really all depends. Multiple credentials do not impress me, only because I have had experience knowing, okay, even people with multiple credentials really sometimes don't understand. They're just able to pass a certification exam. And that's the ins and outs of it, folks. So again, employers don't care if you have multiple credentials. What they are looking at is, do you have the ability to be able to code this, you know, whichever setting that you're going to be sitting in, right? Whether it is for the inpatient side or the outpatient side. Now, I'm going to talk about the CPC exam on another episode, but people will ask, you know, should I do this AHIMA credentials or should I do the AAPC credentials? So with AAPC, you do get multiple, it's a multiple choice exam. So with AHIMA's credentials, they're the CCS and the CCA, and even the CCSP, they're broken down into 2 sections. So they have a multiple choice section, and then they have the case study section. So keep that in mind when you are deciding on which association to go with. You only need to go with one to start, okay? Go with one association to start with, and then that way you can start building from there. There is no sense in trying to get multiple credentials if you are already with one association. So again, if you want to get the CCA or the CCS, there is no sense in getting the CPC, because the CPC says that you can code outpatient. So does the CCA and the CCS. So again, that is something to keep in mind when you are thinking about, okay, which association do I want to go with? So your chances, again, are going to be greater to be able to find a job in either inpatient or outpatient setting by going with the CCA or the CCS. So it really all depends on you. Now, if you get the CCA and you start off with the CCA, the entry-level credential, and you say, well, I'm going to go ahead and do this, and I'm going to continue to take this time to study so that I can go for either the CCSP or the CCS in 2 years. Let me give myself 2 years at least. And I say 2 years because of the simple fact that you'll be able to start to kind of really understand what's going on at the end of the first year. By the end of the second year, you'll be like, okay, now I really understand. I don't know everything, but I understand more now than I did 2 years ago. And there's nothing wrong with that. Well, Blue, that's just too much time. It takes too much. No. Slow down. Slow down. Because of the simple fact that it takes time to learn and amass knowledge. People get stuck on things like anatomy and medical terminology, and they get frustrated right there at that part. Can you imagine adding on like the coding side of the house now? So give yourself time to understand it. As you are in the industry, you will go up in your knowledge, you will go up in your responsibilities and things like that. So take the time, learn it, spend the time to learn it. Don't spend the first 2 years trying to rack up as much credentials as you possibly can because you think that that's going to help you to make more money or that's going to give you more opportunities. It's not, guys. I have seen many folks who have lots of credentials still struggle to be able to find a job. And you know what happens when you have multiple credentials like that? You still have to be able to maintain those with continuing education units, regardless of whether you are employed or not. Yes, there are lots of places that offer free continuing education units or low cost continuing education units, but You have to be able to do the research on that, okay? So again, that's just something to think about. But when it comes down to those two, I mean, I always recommend the credentials with AHIMA, and I do recommend the credentials with AAPC as well. But when it comes to that, I mean, how better of a deal can you get when you have one credential, either the CCA or the CCS, and it says that you can code both inpatient and outpatient? You know, you don't have to rack up multiple credentials in order for somebody to know that you can code. You have that ability to be able to code both inpatient and outpatient. Okay, so if you have the opportunity to learn, some programs do offer that. They'll say, well, we will train you for the outpatient setting, but if you want, we have this additional program, or it's additional weeks or whatever to study for the inpatient side of the house. You can do that too. You know, if that is available to you, you can still do that. You can still train for the inpatient side, even if you decide not to take the CCA or the CCS, and just say that you want to take the CPC, but you still study for the inpatient side of the house. That's fine too, because that says that later on, if you want to go back to it, if you really want to get into it, and you say, well, I kind of understand it, but I don't really understand it, so I'm going to go ahead and go with the CPC, because that's all outpatient, and I understand the outpatient setting. That is completely fine. But you've had that training now, right? You've had that training for the inpatient side of the house. And you can put that training down on your resume if you want to, but you may not be proficient in it yet, but you have had training in ICD-10 PCS. That's going to make you look good. And I have seen some inpatient coders with a CPC. It really all depends on the facility. Some facilities are willing to train people to do the inpatient side of the house, even with a CPC credential. So again, it really all depends on where you are applying and where you want to work at. So, but I hope that this has answered some of your questions about which one to go with. Again, it really is all up to you. I know that that's well, that doesn't really help me, Blue. Again, I've explained that one is beginner entry-level credential. You can still get a good job with the CCA, okay? I've had many jobs. I have done profi coding with the CCA. I have done same-day surgery coding with the CCA. I've worked for level 1 trauma hospitals with the CCA. So again, nothing stopped me when I had the CCA. Nothing at all stopped me. So again, could I have worked on the inpatient side of the house? Absolutely. But my coding home has been in the outpatient setting. That was where I started. I started off working at the Cancer Therapy Research Center, and then it just went from there. I did hospital profi coding, which was my next position. And then now I am doing clinical coding, the clinical setting coding. So, I mean, again, I can do anything. And I did it all with my CCA. So, you know, but I've got a lot of stuff education-wise going on in the back, okay? When it comes to learning the inpatient side of the house, it's a completely different mindset, folks. So, yes, the CCS is going to be on the horizon. And again, I have stuff going on educationally in the back that I'm not bringing to the channel just yet, because I do have to have certain things that I am going through in the process. I have to do this by myself, okay? But I will bring it to you guys in due time. But the CCS is the gold standard of medical coding credentials. And yes, it is a worthwhile credential. Even the CCA is a worthwhile credential to get. But your career, and I will say this before I wrap it up, your career is going to be what you make of it. Whether you are holding a CCA or you are holding a CCS, if you don't make the effort to get out there and be proactive when you are looking for your job, you will have the CCA or the CCS and no job. If you are not trying, if you are not applying yourself, you can still be stuck. Even with a CCS that everybody asks for, you can still be stuck. If your resume does not look good, if your cover letter does not look good, if you are not applying for other positions to try to get yourself into a medical coding position, you will still be stuck even with the CCS. So having a CCS or a CCA does not guarantee you a job. Being certified as a medical coder does not guarantee you a job. It is your responsibility to get out there and to be applying for these jobs. Is it difficult in the beginning for brand new medical coders? Absolutely. Do I wish that would change in our culture? Yes, I do, because I believe that the industry is losing a lot of talent because people are not giving new people a chance, especially when they can pass the beginner assessment test. When they can pass that, they should be given a chance. But again, you know, I dealt with a lot of closed doors in my face. I applied with the temp agency. That was how I was able to get my first job in medical coding. And some people will write me continuously and tell me, Bleu, I'm so frustrated, I can't find a job. I don't know if they're taking my advice as far as applying with the temp agencies. I don't think they are, because if they were, I know that they would at least get something. And once you start getting those temporary assignments, even if it's just for a week or a month, that's fine, because that's still some sort of experience now that you have on your resume. And that looks a lot better than not having any experience at all. Okay? And so doing your resume right and making your cover letter good and not sounding like everybody else is the key to success. Being stubborn and still applying anyway. Even when you've been rejected for a position, you still apply anyway when they open up the job listing again. That happened to me at the position that I got that I'm in now. I actually didn't initially apply for this one because there was another position, right, that I had applied for. It's a lower position, but I applied for it because I wanted to get a job here. So I applied for it, had a great interview. Then I didn't get the call back. I was devastated, yes. But when I saw just a short while later that they opened up the job listing again, but it was for a higher position, I went ahead and applied anyway. Why? Because even though you rejected me the first time because you didn't call me back, even though I thought we had like a really good connection going and we had a really good interview and you didn't call me back, that was fine. I'm going to go ahead and apply for this higher position anyway. And you know what? I got it. So that being said, my stubbornness was what drove me to be able to get that higher position than I would have initially gotten. So you think about that. Next time you've been rejected, don't feel that rejection and be like, oh, that's it, it's over, and I'm tired of this. No. You have to be stubborn and you have to get out there and still apply anyway, because somebody who is freshly trained as a CCA or a CCS is going to be very valuable. That is still a valuable skill to be able to have and to be able to attain. And if you went through one of these fast medical coding programs, oh, we're going to train you in 16 weeks and we'll be able to get you out there to a new career in just a few short months. No. It doesn't mean that what you learned at that program is going to be the end-all, be-all. You still have to study on your own. Because, again, like I said, you have to be able to pass the employer's assessment tests. So be able to do that, guys. That's what I'm telling you. So if you're out there, stick with it. If you're trying to decide which one to go through, either one is going to set you up for success. But the ultimate way to be successful is on you. It is on you to continue to study, to continue to build your knowledge base, to continue to get out there. And even if you've been rejected, you still go through that interview, smile, and say, okay, you know what? That's more experience. It's preparing me for the next one. It's getting me ready for the next position. And for that position that's going to be out there to appreciate my skills and what I have to offer. Because I'm not going to give up. That's just my advice anyway. So I'm going to wrap this one up. Thank you guys so much for joining me, and I will see y'all on the next episode. Please like, guys, subscribe, and share this if it helped you, because it may help somebody else. I'll see y'all next time. Bye.